Hello and welcome to Pain Unfiltered, where we go in-depth into the interventional pain and spine world with some of the top key opinion leaders and executives in the space. We are your hosts, Dr. Patrick Buchanan and Dr. Timothy Deere for this ASPN podcast. Let's get started. Welcome to episode 3, season 4 of the Pain Unfiltered podcast. I'm your host, Dr. Patrick Buchanan, and with me is my co-host, Dr. Timothy Deere. Tim, how are you doing today as we approach 1 month away from the annual conference?
Patrick, I'm doing extremely well. It's a beautiful day here in West Virginia. The sun's shining, the humidity is low. Things are good, and I hope things are well there in California with you and down in Texas with Melissa.
Yeah, we have a great agenda to talk about today. We're going to talk a little bit about the meeting and what we're looking forward to with Dr. Murphy, as well as some new SCS guidelines that may be in the works as well. But before this, we wanted to talk about a new sponsor for our season, Spinal Simplicity. They were with us last year as well. We had a great episode with them, and we're going to talk to them about their latest improvements in their technology. Tim, I know you have a lot of experience with Minuteman. Give us your thoughts on Spinal Simplicity.
Yeah, I think, again, I think the value of any minimally invasive company is they continue to innovate. I think when you've seen things fail over time, they fail because lack of innovation and lack of research. So, I think I've been very pleased with the work that Spinal Simplicity have done. The new generation of Minuteman, I did a case just before I came over. I have a visitor from Panama, and he's here doing his MIS certification. Dave Dickerson's running with his team, and he was amazed. And the new generation is very, very minimal. It's very low risk, and certainly the indications are very clear. And then secondly, they're doing a great job with, they're doing a lot of research right now. We're involved in 3 studies with them. So we've asked the MIS companies to really get some data, and they're getting data. So nothing but good things to say about Spinal Simplicity. I think they're going to be a very important factor for patients going forward, and they're going to keep getting better.
Yeah, looking forward to discussing their latest technologies later in this season as well. We also like to thank our other sponsors this season, to Notrix Health and Medtronic. We appreciate all your support. And we're going to introduce our now special guest, second time on the Pain Unfiltered podcast, Dr. Melissa Murphy.
Third
time?
Third
oh
time.
My gosh. Look at that.
You may have the record.
Thank you.
So you may have the record.
You may hold the record. Exactly.
Hey, what an honor. Hi, everybody. I think I know many of you all, and Dr. Melissa Murphy in Dallas, and one of the pain physicians. I'm also sitting on the board with ASPN, working with Tim and Patrick. So it's just such an honor to be on the podcast for the third time. So I watched you grow, Patrick, from the very first episode, first season, to now your season 4. So thank you for everything that you're doing for ASPN and for our members. This is tremendous. Very impressive.
No, appreciate Melissa. It's also been great watching your career grow. I feel like you're all over social media and doing big things. So we appreciate you coming on again for the third time.
Well, thank you for having me.
Let's talk about, real quick, let's talk about kind of the latest news in our industry. Kind of a big acquisition here. We had Medtronic purchasing SPR, and you guys are pretty close to these companies. So love to get your thoughts first for $650 million.
Yeah, I mean, I think this is extremely exciting. It's such a milestone for our specialty. And I want to congratulate SPR and Medtronic. And, I think this acquisition reflects something that we've been really witnessing the past several years, which is neuromodulation, especially PNS, is becoming an important part of our treatment algorithm. And if you think about the future of pain medicine, it's not necessarily between, conservative management or implants anymore. Now we have a continuum of options of therapies that we can offer to our patients. But, ultimately, this is less about one company acquiring another. It's a validation of where our field is headed. It's a validation that neuromodulation has its place, whether or not it's SCS or PNS or other neuromodulation therapy options. What about you, Tim? What do you think?
Well, I think you said it well. I'll just add a few thoughts to that. First of all, Maria Bennett and her team, what a great job. And I think it's rare that a founder can also be a CEO and do a good job. And Maria proved that to be true. And I've always been impressed and loved working with her and her team. But two is, I think it proves data is currency. Something
That's right.
And the people at SPR created data. And I was blessed to be in some of those studies with people like Chris Gilmore and Denise Lesser and many other folks that are good friends of ours, Dave Dickerson. But I would say that just proves it, that if you invest in studies and they
Mhm.
show that your device works. And again, it has to work. That's the important part. Then it becomes very valuable. And I think the other thing that this shows is, Paulo, who recently went to a trauma unit over I think at another company, and now Dominic, who took over as president of Medtronic, they really saw the value of having more than one device. And I
That's
think
true.
that we need more than one device to treat people because we need more than one therapy. I think the more diverse a therapy can become, the better options we have. So I think it was a great thing for the space. It was a great thing for patients, most importantly. I think it's going to be the beginning of a lot of these things. We're going to see a lot more consolidation because I think that startup companies do the innovation. And there's a point where they can't take it any further. And that's where we need the strategics to come in and take over and then invest in additional studies and additional innovation. So I'm very happy for the space, happy for both companies, but really most of all, happy for patients.
Yes, that's right. Very well
Yeah,
said.
I just want to piggyback off of that, Tim, as well. Yeah, this is becoming an arms race with a lot of these companies. So the goal is to provide as many treatment options for patients and physicians as possible in kind of a one-stop shop. And like you said, Tim, it rewards the companies that are doing the work, putting in the money to research education, and now it's paying off. So hopefully down the road, there'll be more companies like SPR, like what Intercept as well did after they got acquired by Boston, to really do it the right way, put in the money, put in the work, produce data, and then get acquired. And hopefully this is kind of a blueprint going forward.
Mhm.
So I think the next thing we're going to talk about, Patrick, and correct me if I'm wrong, we're talking about the annual meeting. And,
Mhm.
when I started Aspen with Dalvitz Ad, he was supposed to be here, but he's, as we do, he's in the OR working right now because his cases were done. So I think that goes to show you the people of Aspen do work, and he's working right now helping patients. But what we decided to do, I recused myself on the meeting. So I never choose any speaker or topic or anything like that. And Kaz Umberdelfon, David Lee, and others have done a great job in organizing that. Melissa, you've had a big role in Thursdays. So I thought what I would do is pick a day, start with Melissa on Thursday, then
Mhm.
go to Friday, back Saturday, then Sunday. And for a lot of listeners out there, I know a lot of people are planning to come to Miami. We had over 3,000 people last year. I think we're going to have more than that this year. But I want to know what excites you and what should people be looking for in each day as highlights. I know there's a lot of things. We can't name them all. The days are big, days are long, the nights are big and long. But I know they're saying, so Melissa, what about on Thursday? What should people really be excited to hear about on Thursday?
Yeah, thank you. So I just pull up the agenda. So first of all, I think I want to mention the theme this year, right? So this is the 8th annual ASPN meeting, and the theme this year is Intelligence Meets Human Insight, where data and discovery unite to transform patient care. This is a very thoughtful theme because if you think about it, this is what we're experiencing nowadays in medicine, which is technology is advancing faster than ever. And we have AI nowadays that's reshaping our workflow, impacting patient care. And we have new therapies, we have new data. But ultimately, great patient care is dependent on, I think, human judgment, experience, and insight and empathy. And I think this meeting is designed to explore that intersection among all these things. And what really excites me about this meeting is there's really something for everyone. This is not just a meeting about new technologies and new data, new evidence. We really have something for everybody. We have innovation, we have business, we have policy, entrepreneurship, AI, new technologies, and how we develop the next generation of leaders. So, if you're in pain and neuroscience, I really think you will find this meeting fascinating and helpful, and also just meet people. The networking part of Aspen is truly what makes it valuable. But going back to answering your question, Thursday. So Thursday is probably my favorite day nowadays. It's the pre-conference day. And then I know in the past, a lot of people will fly in on a Thursday night for the Friday meeting, Saturday meeting. But nowadays, I really encourage you to come in on Wednesday because Thursday is extremely exciting. So we actually have 4 concurrent sessions. Neurotech Horizons is something I'm really passionate about. This is the second year. First year, we did extremely well. We have a standing room only with hundreds of attendees, and we're going to continue that momentum with the second year. So this is not about medicine anymore. This is more about innovation. We're going to invite industry members, VCs, startup development. We're going to discuss digital branding, AI, cybersecurity, regulatory, and the next decade of what's coming in the next 10 years in neurotech. But concurrently, we have a few other sessions going on. We have hands-on cadaver courses that fellows love. And we're going to discuss neuromodulation, DRG, BVNA, intrathecal pain therapy, and MIS procedures. At the same time, there's going to be that regenerative medicine session with ultrasound guided procedures. And we're also going to have, this year we brought the APP breakout session from Friday to Thursday because we want to have this dedicated time for APP partners to discuss clinical pathways, evidence, and day-to-day clinical care. So there's really something for everybody. And that's just the morning of Thursday. And Thursday afternoon, Dr. Krishnan Chakravarthy has to work on this pain and policy innovation forum. And I love his vision of, this is more about medicine anymore. There's a lot of policy shaping around this. And sometimes we'll focus so much on clinical care and patient care that we don't really know the payer pathways, the policies, the regulatory, the reimbursement side of things. So he is working on this innovation forum that he will talk about research, data collection, FDA reimbursement, prior auth, registry, and how we can shape the future of policy. What he said was, in order to improve patient care, what we need is evidence. But in order to generate evidence, we need data. But if we want to influence policy, we need both evidence and data. So I'm looking forward to the Thursday afternoon session of Pain Policy Innovation Forum. And Thursday evening, we have the poster podium where our poster podium mentees will present their research that they've been working on for the past year. And Patrick, I want you to talk about your passion project on Thursday evening.
Well, I'm exhausted.
Yeah,
I'm exhausted from hearing all that. I mean, that's a lot of time.
yeah. I don't know how to follow that, Melissa.
Wow,
That was great.
much more, but that's fantastic. I mean, that's fantastic. It goes to show, Melissa, people like you, really led a revolution here. And, Bobby Mogan talking about AI and his group, and, the regenerative medicine section, Matt Grocka and Chris Robinson and Jordan Tate, and, Krishnan Chakravarthy and Hemant Kalea talking about regulatory and all those things. And we're going to have a big announcement about the registry. We'll have the best registry in the whole space for spine of any type, led by Tim Davis and Nuzman Latif and Noam Nazim, and Marcy Carr's coming up soon. So we'll have, that announcement comes out in a week or so, the formal announcement. Wow, Patrick, I've been sorry to take your thunder about the other thing you got going on Thursday.
Yeah, no, that was great, Melissa. Great summary. I just want to give you a shout out for the Neurotech Horizons. You've done a great job with that. That was one of the most talked about programs last year that I got feedback off of, was how impressive that event was. So great job on that. Keep that up. And yes, we are having a new event this year, the New Innovators Pickleball event. It's going to be off campus, about 10 minutes away, quick bus or Uber ride over there. But, this is for everyone, not just the young innovators. We just want to create this community. And I think that's the heart of Aspen. It's doing, something that we enjoy, networking, meeting people. It'll be tons of fun. We have sponsors. We have Carbon, who is a pickleball company that's sponsoring it as well. We're giving away also free, Tim, you mentioned we're going to give away free admission for the yearly event, annual event, and also for ASPN as well. And I think there's also lead going to be raffled off as well, protection. So it's going to be a great event. Whether you play pickleball or not, come socialize. It'll be fun. It's sponsored by Aurora. They're doing a great job putting this together too, so that'll be fun as well.
Yeah, and I think we're going to announce our Young Innovators Award recipient at the event as well. So come join us and come celebrate the Young Innovators and also watch Patrick Buchanan playing pickleball.
Yeah, you'll be able to play with.
The Young Innovator Award is going to be great person who deserves it. Really tremendously. Right. But I will say, Patrick Buchanan, for those who don't know, Division I tennis player at Notre Dame, and now a great athlete, and he's a world-class pickleball player. So I got my money on Patrick, but for those of you who think you can bring down the king, we'll see how it goes.
That's right.
Yeah, appreciate it. Yeah, we'll be teaming up with hopefully some of the board members out there as well. If you beat us, we'll give you some raffle tickets to raffle some prizes like pickleball paddles and gear as well.
All right, so now let's go to Friday, Patrick. We got Thursday out of the way. If we don't break any hips or tear any ACLs or the pickleball, we'll get into Friday. So, Patrick, what are you excited about on Friday?
Yeah, this really kicks off the general sessions in the morning, and we have a lot of great topics. I just want to highlight a couple of them. The first one is the surgeon interventionalist elevating patient care together. This is moderated by you, Tim, and Dawood. And honestly, I think this gets to the heart of what Aspen is about, is collaboration with our spine colleagues and how we improve that and how we help patients overall. So I think that's going to be a really important one to kick it off with. Following that, we have AI topics as well. And I think this is huge in our field now, as every single field, not only medicine, but business and social media and everything's going towards AI, and how that can best help our patients. So Dr. Latif, Dr. Mogum, they're going to be monitoring a panel on the current artificial intelligence platforms for clinical efficacy. Dr. Charkavarthi is going to be monitoring another one for how we use AI for clinical decision making. So I think these are important panels for us as well. And then in the evening, we have our 5K annual run. Tim, it's been how many years now? 6, 7 years?
Well, so, we started this 5K years ago in a study called WVSIP about 25 years ago at the Greenbrier Resort in West Virginia. And we've had some variation of that ever since. We've had a triathlon in Puerto Rico. We've had a triathlon in the Bahamas. People couldn't swim very well, though. So we went back to running and we raised money. So, we raised money for, over the years, Make-A-Wish, St. Jude, other charities. This year, Ironman Foundation, which is always one of our charities. And really, we're focused on teaching children in urban areas and rural areas to swim. We think that's very important to avoid accidental drownings. But we have a new charity this year at the 5K. It's a Do Like Duke Foundation. Duke was a 10-year-old child who had a unfortunate end of his life from an accident, and his dad is a veteran of our space for 20 years as a device representative, doing a fantastic job. So we've invited his father, who's really touches me talking to him. And he's really just a brave family, very brave to go there and help others. They're trying to educate others about, trying to avoid these types of things. And we're going to be the Do Like Duke Foundation is going to be one of the things we're raising money for. You'll hear from Duke's father at the pre-race and post-race, talking a little bit about the charity. So that's one of the things you'll be raising money for when you run with us. And if you want to run, you can walk. It's not that hot at 5 o'clock on a Friday in South Beach. It's probably 95 or so. But if you don't want to walk, you can run. You can still donate money. We'll get you a shirt. And if you don't want to run, you can hang out at the beer garden and donate money and get the shirt anyway. Kelly Castleberry and Morgan Stanley is sponsoring the race as far as sponsoring all the shirts and things of that nature. So it's a very good event, and I think everyone comes out and they help others, and I think that's the beauty of that. And I think having the Do Like Duke Foundation this year is one of the receiving charities is going to be very special.
That's right.
Great. It's really a community event, because you see, different industries have different team shirts, all together running as one. It's a great event. Socialize afterwards. Talk to Tim. Talk to a lot of the people on the boards. Great networking event as well.
All right, great. And I'm going to be 1 week before Badwater, so I'll be running very slowly, not to get injured. So that's Friday.
Yes.
Of course, there's a lot of things on at nighttime. There's a lot of events you can go to, a lot of courses and sponsored events where you can learn about the new therapies from each company. And I love that. Melissa, we're getting to Saturday now. What excites you about Saturday?
So Friday was more spine day, MIS day, AI day. Saturday is neuromodulation day. So we're going to take a deep dive into neuromodulation, including SCSPN, SDRG, motivitis stimulation, and the future of restorative therapies. But, the discussion isn't going to focus just on the devices and therapies, and we'll discuss patient selection, evidence, access, outcomes, and how AI can truly influence neuromodulation in the future. And the Saturdays, we also have some very special moments. We'll present the ASPN Lifetime Achievement Awards. We'll honor the memory and legacy of Dr. Michael Fishman. And Tim, I know you're going to give a fascinating presentation on longevity and health span that I'm actually really looking forward to learning more about that. Saturday afternoon. So we move the practice management session from Thursday to Saturday this year, the one that Dr. Paul Lynch teaches. So this year is going to be business and law in medicine on Saturday afternoon. It's a breakout session. So, a lot of us receive extensive training in clinical medicine, but very little education on the practice management side of things. So this session will be about billing, compliance, legal risk, personal injury, expert witness, MIA, private equity, digital marketing, and concierge medicine. So very interesting topics that we don't learn in medical school, in residency, fellowship. So this will be a really good way to wrap up our Saturday afternoon session. So that's Saturday.
Yeah, just a few comments. First of all, going back to Friday, I think we have some world-renowned orthopedic spine and neurosurgeons at this meeting who are going to be on those panels. And those turf battles you've seen on LinkedIn become collaborative discussions. And I think that's really important. I think that's how we help patients. Two is Michael Fishman, dedication to Michael, who certainly was a valuable member of our society, but also just a wonderful person who I had the pleasure of knowing and working with on the two projects. And we're going to have David Reese and Chao Vu, a little bit of discussion of his life. We're going to be signing a Michael Fishman pen for the Michael Fishman Foundation. We're going to be announcing for a scholarship to come to our annual meeting and get more education, which Michael would have liked, because he was so into educating young people.
Yes.
And so that'll be, I think, a very touching event. And we're going to also have, which will be officially announcing that scholarship, and then we'll have Chow and David come up and talk about his life a little bit with some special guests. And then we're going to have a Lifetime Achievement Award presentation to Dr. Elliot Crames, who maybe you may know was one of the really followers of our field. He started intrathecal pump delivery in San Francisco. He trained a guy named Kaz and Rodolfo. We still blame him for that. But other than that, we did a lot of great things too. And then we'll have Stephen Huckschuller, who was one of the founders of Texas Back Institute, one of the first ortho spine surgeons to really think that interventional pain had a real place in the space. And instead of fighting us, became a partner. He's still a partner. Stephen and I partner on several projects, and I think he does a great job. So we'll be honoring both of them as well. So much going on there on Saturday. It'd be a great event. And then these are the Sunday, Patrick. What we got for Sunday? I know some people want to stay and get as much CME as possible and go home Sunday evening. What's going on Sunday?
Yeah, if you haven't had enough, Melissa will be moderating the peer-to-peer, poster podium abstracts. Peer-to-peer. I know. I see P2P here. I'm like, my brain goes to peer-to-peer. I'm having PTSD because I do so many of those. But yes, poster to podium abstracts. The top young innovators get to talk about their research and the hard work they've done for the whole year. And they're always very, very impressive of what they come up with and the results. So definitely stay tuned for that. And then the last thing is coding and policy updates. It does sound maybe boring and mundane, but Dr. Hemant Khalil is huge in this and is a big part of ASPN and how we're getting coding and reimbursement in there. So he will have great insights for that as well.
Hemant, if you don't know who Hemant is, if you're listening to Dr. Clay, he's the vice president of regulatory affairs for us. And very few people know as much about coding, billing, compliance that he does. He's also going to be very important going forward with the major project we'll be announcing after this meeting. But that would be very valuable. And then when you have a code that you're struggling to get approved, what you don't know behind the scenes, other people take credit a lot of times, but Hemant has been critical. Him and Mark Malinowski has worked with him very closely. Harry Zuckerman up in Detroit, Tariq Alfari in New York City. Those guys have done such a fantastic job of helping us keep access for patients. So I think that'll be a very valuable session. And I think stay tuned. We're going to have something coming in the spring where we may focus a lot more on things like this for a weekend sometime this spring to really help your practice. So it should be very valuable. So Patrick, thank you for that. Melissa, that wraps up the annual meeting. I'm exhausted listening to it. I think by Sunday night, we'll all be ready to head back to our homes, ready to get some rest.
Yeah, I just want to give a shout out to the annual meeting planning committee. I know this is a lot of work over many, many months to organize a conference of that kind of scale. And then I think the very impressive part of ASPN is it doesn't matter what your interest is, you're going to find something very insightful and actionable from this conference. So this is probably the most comprehensive pain conference that we have in our space, not just focusing on neuromodulation, but regenerative medicine, business, and policy, and the things that we care about, and that will translate to patient care. So I can't wait to see everyone in Miami in July for ASPN 2026.
Yeah, for me, the key word here is energy. There's just so much energy.
That's right.
Things and energetic, great people and older, wise people and young, energetic people, and the combination is great. So I think we have about 10 minutes left, Patrick. I want to cover one last thing, if we could, and maybe you can lead this discussion. We're going to have we had the Neuron guidelines, which have led to really reimbursement decisions on things like PNS, on BVN, on SI fusion, on SCS and DRG in the past. We're going to have a whole new set of guidelines specific to devices. So if you want to introduce that topic, and maybe Melissa and I can talk with you for a few minutes about that.
Yeah, absolutely, Tim. I know you and Jason Pope had a great discussion at INS this year about kind of the current state of spinal cord stimulator guidelines, how it's been proposed, who determines it, should there be evidence-based studies included in that? Why don't you give a brief synopsis on what has been happening behind the scenes?
Well, I think we value all, all societies' work on guidelines. I've been in quality guidelines since 1999 when Rick Creams and Sam Hasselberg and Michael Cousins brought me into something called PAC back then. What we've learned, though, I think, is over time, we have a lot of folks who get chosen for guidelines for the wrong reasons. And one thing Dr. Pope felt strongly about, and I think we're going to have Dr. Pope back with Melissa and some others. Will that be your fourth appearance, Melissa, at some point in the near future? Talk about really, we think there's some value in having people doing guidelines who actually has clinical expertise. And sometimes we see people chosen to lead a guideline because they've talked a lot about, things like, can they do a non-biased study? But they haven't done any implants. They haven't done a BVN. They haven't done, a lot of minimally invasive procedures or spinal cord stimulators or DRG. So we're going to have one thing we look for, Patrick, is that's to be the criteria. There'll be a lot of people we include because of their clinical expertise, because that's really how you learn. And I think that's important. We did a surgical paper where Dr. Philippe Brigard from France helped me do that paper, and he's a very experienced surgeon. So that's a good example of that. Then we're going to also look at, really the evidence-based studies that are done by industry for things like IDEs for FDA approval, some of the most scrutinized studies of all, and maybe Melissa can expand on that a little bit. And then the independent studies, and we'll look at the importance of those. And I think the reproducibility of the studies can be very valuable in our grading system. And we're going to come out with something called the implant guidelines. And we'll have one for all implantable therapies for pain, which I think Melissa will be one of the leaders of that paper. We'll have one on SCS, one on pumps, and one on DRG. And we just did one with Dr. Lateef on PNS. We may redo that in about 24 months, though, because as things go along, more evidence. So that's the main spectrum of that. And I think our goal is to make sure it's clinically relevant and not just some academic theory of people who don't do implants. I think that's going to be Melissa, your thoughts?
Yeah, I want to reiterate some of what you said. As many therapies have become more sophisticated and widely adopted, I think the question is no longer whether or not therapy works, and we know it works from some of the studies, but the question becomes, how can we ensure that we use the therapies consistently and appropriately and safely across the country? And we want our patients to get the consistent experience. Doesn't matter where you get the therapies and what parts of the country, done by what physician. That reminds me, 8 years ago, Aspen was more about focusing on education, but now we're the leading voices in pain medicine. And with that growth and transition, it comes responsibility that we as Aspen, as a society, is our job to define standard for the field, standard for the specialty. And so I love the idea of doing this implant guideline. So I think that gives us opportunity to shape how the therapies are adopted across the country. So, just kind of expand on the things that you discussed. I think, a few different pathways that we briefly discussed, PERC SCS, paddle SCS, DRG implant, intrathecal pain therapy. And these are important implants I think we need to discuss. So we're going to gather some of the top leaders from this phase and review the evidence, review the guideline, and come up with consensus and with grading and evidence. And hopefully we can distribute that to the field so we can really raise the standard of how we deliver therapy across the country. And ultimately, and this is about our patients, because we want our patients to get, standard care, excellent care, doesn't matter where they are. And we as society, as Aspen, we can help to develop a recognized standard for training, patient selection, complication management, procedural skills, and maybe even some follow-ups. And one other thing that, I think is important that we often don't think about is why this matters to payers. And just like we said, Patrick, we do so many peer reviews, we deal with denials and appeals because sometimes we want to access cares for our patients, but we don't have the access to, right? So we're limited on the payer policy and pathways. So by developing some of the guidelines, I think this is important for payers because that's going to drive reimbursement, drive the policy coverage, and drive the standard. And so we need something to show to CMS that, this actually truly works with great evidence, with experts consensus guidelines, and this will be very helpful for policy discussion and advocacy as well.
Yeah, I had a few occurrences recently where I was talking to some CMOs of some insurance companies. Just a few examples. They cited our BVN guidelines. They cited our PNS guidelines. And so while some people say, well, we want to take 3 years and spend $500,000 and have a bunch of statisticians, we really think the clinical relevance is what's really going to be driving forces here. We can look at the clinical data. And so I think, Melissa, you're right. I think that this is going to be the importance of this. So stay tuned. We'll be appointing a large panel of experts to create the papers with some good leadership. We'll have a good policy of recusal for those who have a relationship with people they're making those judgments on. It'll be really, I think, a fantastic endeavor to really try to make sure patient access is guaranteed when you have the appropriate studies, because we've all had peer-to-peer. And Patrick, I think it's going to be crazy. I think we've all had that peer-to-peer where they've actually quoted our own literature to us. And like, that's right. That's why you should approve it. That's our literature. And so I think we want to have more of that where we can say, okay, based on this relevant publication, it's important. And Melissa, I think someone like you who really is, you're really young in your career, someone like Patrick, young in your career, you both have a great deal of experience. So you have clinical acumen as well as a learned experience. So that's what we want. We want to have this be clinically relevant to the payer, but we want sure the payers feel like they're getting the best advice too. They don't want implants for the wrong reasons. So one of our goals is to improve access. The other goal, though, is to make sure access isn't done for the wrong reasons for people doing it for improper reasons or indications. And so we're going to have a very joint goal here of both improving patient care and safety, but also making things more appropriate. So
Absolutely. Yeah, this is exciting. I quoted the ASPN guidelines at an ALJ hearing in front of a judge, and got it over to him. So, these papers that we're producing has a huge impact on every single level of the appeal process as well. So I applaud what you guys are doing. This is great. Looking for this. I think it shows how much, like you said, data is important. The registry is going to be important, I think, and that's coming up. Looking forward to hearing more on that. If they want to reach out, Tim, to get involved, who should they reach out to?
Well, for the registry, we're going to have an announcement very shortly, maybe before this podcast comes out or shortly thereafter. You're going to hear from a young man named Tim Davis, a physician in Beverly Hills, California. His team has been chosen to run the registry with ASPN. You're going to hear from Dr. Usman Latif from Kansas, Dr. Norman Nazim from Florida, Dr. Marcia Karsh from West Virginia. And you're going to hear about really how you can be involved in the registry. We're going to have a lot of companies involved sponsoring the registry so they can also look at data of their populations of how they're doing so they can learn who does well as well. And you can be able to compare your data to others in the country. You're going to be able to use that when you get you're talking to insurers. So I think it's going to be very valuable. And it's not run by a company. It's run independently by ASPN. So there won't be any company able to bias data regarding to what happens. We'll really learn the real outcomes of what's going on based on the HR. And if you're in that registry as a participating ASPN member, there'd be a lot of value in that for you. And I'm not going to share that with you today, Patrick. I'm going to let people who are more articulate share that. But I think we think this is going to be one of the most important really impacts we can make the next 5 to 10 years is this registry, because as we get more data, we can go to insurers and say, not only does the big data from Medicare and insurers support something, but now we have registry data of our actual members doing procedures, and this is how people do, and we'll have the actual outcome data. And the good news about that is if it works well, we'll be able to prove it. The good news also is if it doesn't work well, we'll prove that. We'll say if someone has this criteria, they aren't a good candidate for whatever that may be. So I think we're going to really get more it's going to help patient selection dramatically in what we do.
That's fantastic. We'll go ahead and wrap up this episode. We'll give the final thoughts to Melissa and Tim and wrap it up after that. So Melissa?
Yeah, so 2 things. Annual ASPN meeting, super excited about it. Buy your flight tickets if you haven't done so, and then book your hotels. It's going to be booked out. It's going to be such a memorable weekend. We have turned a 2-day conference into a 5-day conference. So come early and really enjoy the time there. And the implant guideline, I think this is so important because I think what standard allows us to do is apply technology to reach more patients safely, consistently at scale. And I think that's what our responsibility as ASPN is to raise a standard and create what excellence looks like. And thanks for having me on the podcast today.
Yeah, you're becoming a regular. You might become the third host here eventually if you keep coming on here. So I will say, Patrick, I'll say one thing. I want to really go back to the steering committee and all those who looked at abstracts. So, I've had people before who've never been to ASPN say, "Oh, well, it's a discussion clinically and it's not scientific and it's a fountain blue in July and everybody has a great time." All that's true. We have a lot of young people and young people have a blast there and it's a lot of networking. All that's true. But I'll tell you the one thing I think you're going to really find if you come, and this is what people who've never been, who come talk to me about when they leave. The science is phenomenal. We're going to have 20 abstracts over those days that have been chosen as best in class out of 400 or 500 abstracts that really are great science and great level 1 studies, RCTs, really close looks at different therapies. And I think the science is what's you're going to take home with you. You may have a great time, you may have great memories, make great friends, but the science of this meeting has been elevated by Kazim Rodelfon, David Lee, others to really be beyond any other meetings. I'm not saying it's better than all other meetings, but the science equals other meetings, whereas everything else is better than other meetings. So to me, I think come for the networking, come for the camaraderie, but also come for the science because you're going to learn a lot if you attend those sessions.
Yeah, like you guys said, there's so much looking forward to at this meeting in Miami. It just keeps getting bigger and better. I mean, what other society in pain has this many opportunities to make an impact in, our patients' lives and coding and reimbursement and data and studies, networking, partnering with industry? I don't know another society that has this. So if you guys are interested, if you're new members, old members, want to get involved in the implant guidelines registry, abstracts, come to the meeting, talk to Melissa, talk to Tim, talk to me. We're happy to talk to you, get more involved in Aston. But looking forward to it in Miami. And this wraps up another great episode of the Pain Unserved podcast. Thank you guys for joining us.
Bye. Thank you.